your name, where you're from, and also just one word or phrase of how you feel about healthcare right now. And I'm going to give us at least to about 6:05 for others to join, and then we'll get it started because I know everybody's time is important. And I do appreciate you all for joining us today. All right, the time is 6:05. Again, my name is Deanna, and I'm the enrollment assistant with Georgians for a Healthy Future. Thank you all for joining us today. If you can, please drop your name and what city or town that you're from, and also please give us one word or phrase to tell us how you feel about healthcare. And I do want to make just a reminder that we are going to be recording this just to share off of social media. So to make sure we have the best sound quality, I will just ask that everyone stay on mute during the presentation. And please feel free to put any questions that you may have in the chat. We will address all questions at the end of the presentation. All right, with the time being 6:06, um, Anthony, you let me know, do I need to give it just a little more time?
I think we're good.
All right, we're gonna get this party started. Okay, thank you again for joining us today. And I'm Deanna with Georgians for a Healthy Future, and we're going to talk about powering change together and how we can all come together to make an impact for healthcare. And then I am glad that everyone was here, and thank you all for joining us, those who've registered to attend. Again, I just want to take a moment and acknowledge everyone and their time, but please, if you feel comfortable, drop your name, the town where you're from, and share with us one word how you feel about healthcare costs. Now, Anthony, I can't view the chat, so if you see any words or phrases that anyone has dropped, feel free. We can go over just a few.
Sure, I see my own frustrated, then I see upset, apprehensive, another frustrated, another frustrated. So I think there's a theme here. I see confused, broken, outrageous. Uh, the sentiment's not looking good.
And we definitely are on the same page. We are all in agreement. So I think everyone on this call is definitely frustrated with the healthcare and especially the healthcare systems now. So one of the biggest reasons why we're here is we are a part of a campaign, the One Nation Overcharge. And this is a nationwide people power movement to demand a healthcare system that puts our health needs first over corporate profit and something that works for everybody. Now, this nationwide campaign, it takes the conversations that we're already having. Most of us are interacting with someone, whether it's on Reddit, Facebook, some group where they're discussing how healthcare costs are outrageous. So, One Nation Overcharge is taking what's already being discussed online and taking it to the main street and turning it into a movement. As we just stated about the words we're seeing in the chat, nearly everyone agrees healthcare costs are way too high. Big healthcare corporations are putting their profits over our health, and those in power seem to be doing nothing to hold them accountable. It's time we do something about that. This campaign is driven by advocates working across whether it's healthcare, civil rights, racial equity, all the patient advocates. We are all working together across each line to push for better healthcare costs here, and especially in Georgia, we do have some people. And we would definitely love you all to step in and join us on this fight, stepping into the fight, speaking up, and demanding better. Georgians for a Healthy Future, New Disabled South, NAACP, National Urban League, and many more have joined the partners working in healthcare to launch the One Nation Overcharge here in Georgia, but it is a nationwide campaign. So you're going to see people across different states who are pushing and joining One Nation Overcharge to push for this change and join in on this movement. So there are some root causes to why are we being overcharged for healthcare? One of the biggest things is just the lack of corporate accountability. No one is checking these healthcare corporations while they're continuing to drive the costs up without improving care. This is what happens when they prioritize profit over patients. Healthcare should not work for patients. Healthcare should work for patients, not just for corporate profit. We need accountability, we need affordability, and we need a system that works and put people first. Then we also have systematic inequities. The cost crisis does not impact everyone equally. Healthcare affordability is a racial equity issue. Everyone deserves a fair opportunity to access quality care, regardless of your income, your race, or the zip code and where you live. And then we want to move past cynicism. This is where we're going to turn our anger and frustration into action. People are angry, and this is justified. Families are exhausted by these high costs, high healthcare costs, constantly receiving denied claims in a system that often doesn't work for us and put profit ahead of our needs. I'm sorry. But anger can be a catalyst for change. We cannot let the frustration turn in resignation. We can turn our collective angers into action and demand a healthcare system that works for people. Our anger is justified, but it can be more than just anger or frustration. When we collab together, we'll be able to move and push for change and demand change for a system that will work for us. Healthcare should be a right, and our system is wrong. Whether it's the cause of an inhaler, or you need some insulin, or you just need to get a CT scan or routine lab work. And also from the medicine at the pharmacy or going to the emergency room, co-pays and high deductibles are just ridiculous. We are all being overcharged for healthcare needs, and that has to change. Most recently, Georgia Health Initiative did a poll in June, and this recent poll, my apologies, this recent poll found, I'm sorry, this recent poll found a lot of things that Georgians were looking for and what Georgians felt how healthcare is handled in Georgia. More than 3 in 5 voters say that healthcare is not affordable. Over a third of the Georgia voters reported skipping or delaying care in the past year due to cost. About half are worried about an unexpected medical bill or whether or not they can pay for their copays or meet their deductibles, even paying for the high monthly premiums. And then also, some are even considering cutting their dosage for medication because they can't afford to get their next prescription. 84% agreed that the healthcare system is more about money than people. In Georgia in particular, Georgians carry twice as much medical debt in compared to the US as a whole. Just some facts around that. The healthcare cost has increased 188% over 2 decades. People in America owe more than 220 billion in medical debt. 36% of Georgians skip care because they cannot afford it. 22% of Georgians skip medications to save money. And 16% of Georgians spend more than 10% of their income on out-of-pocket expenses for their health. As an enrollment assistant, I see that this takes an impact in many ways as I help those who are trying to get health insurance. But some ways this has also impacted them is showing from 2025 to 2026. Georgians who purchased health insurance through the Georgia Access Consumer Portal saw their premium costs rise by 114% on average. If your income's not rising at that rate, how can you afford to pay for health insurance? And we also know that Georgia has not fully expanded Medicaid. But for those who are Medicaid eligible Georgians, they have a long wait time when it comes to having their insurance applications processed and approved. And this affects children in low income families. So they're being asked just wait a while before they can get their school enrollment check-ins or their shots, as well as waiting to get approval for prescriptions when it comes to asthma inhalers and just any medical necessity need that they have, they're being delayed that care in order to wait on health insurance to approve it. During the Georgia Health Initiative briefing, there were some key findings and insights that emerged from this statewide poll, and some of these quotes were selected from the focus group participants. In Warner Robins, one constituent said if they receive a big unexpected medical bill, it will break them. How many of us have been at that point where it just takes one thing to happen, a medical bill, a medical disaster, even your car, something to go wrong, and it could put you over the edge where you can't even afford to buy groceries for the next month. One constituent said, I make decent money, but it seems like the goalpost keeps getting moved. Possibly last year they could afford a plan on Georgia Access Marketplace, but now they can no longer afford it as those premiums have jumped high. And then we had a constituent who's in Atlanta who stated, I was supposed to get a mammogram and it was going to be a few $1,000s, so I didn't get it. So by the time I got it a year later, it looks like I have a tumor. How many people have you known have dealt with these issues where they delay getting care and then they receive bad news and now they're struggling to figure out how they're going to pay for their coverage now and pay for their needs now, and they don't have health insurance or they can't afford to get the test done to address their medical concerns? Overall, this research found that Georgia voters across party lines, income levels, all ages, and geographic areas agree that healthcare costs is too much and does not prioritize patient needs. And Georgia's health system is complicated and falls short in coverage, access, and quality of care. So this is why that we ask y'all to join us in this fight as we push for change. Change doesn't happen only in the government. It happens whenever people have the power to organize, influence decisions, tell the truth about what's happening, and demand accountability. Beyond our state and government officials, change makers in the healthcare include the people and organizations with power to influence costs, access, accountability, and patient outcomes. These people could be just your neighbors or someone you go to church with, your family. Their stories in organizing, advocacy, and collective voices can drive public attention and policy change. We also need our healthcare workers to be involved. That include our frontline workers, our doctors, nurses, pharmacists, social workers, and I definitely can't forget my community health workers who put in a lot of work when they have clients who don't have health insurance or can't afford services to try to make sure they find funding to help those patients in particular. But the frontline professionals can advocate for patient-centered reform and expose harmful practices. We all can work with our community organizations. This could be your faith-based group, your neighborhood watch, or your neighborhood organization, a nonprofit. Any grassroots coalition can organize communities and amplify voices that are often overlooked. And we definitely need our patient advocates. Organizations and advocates can help people navigate denials, medical debt, prescription costs, and other barriers while pushing systemic reform, sorry. But one of the things I also like to know is your pharmacist. When you go to pick up your medicine, they see firsthand how medication costs affects a patient and can advocate for greater affordability and access. We sometimes forget them, but just to think how many people turn around and tell them to put the medication back because they can't afford it. And in particular, we definitely want to reach out to our faith and community leaders. These are our trusted voices who are in our community. They already bring people together when it comes to their church or their religion or in healthy spaces throughout your neighborhood. So they are trusted voices who can bring people together and share concerns and mobilize collective actions. But one of the most particular person is you. If you believe that healthcare costs is a right and not a privilege, you can definitely stand up for it. You can join us in this fight and speak up, sign up, and push for change as we are all doing. Now, at this time, I'm going to do a live poll, and I'm pretty sure I know the answer based on some of the chats, but I want y'all to put it in a poll for me. The question is, have you or someone you known delayed care due to delayed care or treatment, or skipped out on prescription, or avoided seeing your doctor because of the cost? And I'll just give it just a few minutes. All right, thank y'all so much. Just looking at it on average for those who have completed a poll, we have 82% said yes and 18% said no. So definitely understand some people, again, it affects everyone differently. Some people are able to pay those co-pays and deductibles, but there are some people who have to strategically plan how they're going to seek their medical attention. All right. Thank y'all so much. All right. So next we're going to get to hear from community voices where they tell us the real healthcare cost stories and the spotlight community members. We have a few storytellers who are going to tell us what's going on with them. I do have Miss Sean Tucker Allen. She is the Director of Faith and Community Partnerships with New Disabled South. I'm going to share the floor with her so she can express the work that she's doing and how they are collab with One Nation Overcharged. And then we will soon hear from Cassandra Nelson, who's one of the community health workers.
Well, thank you so much, Deanna. And I am very honored to be here. As you mentioned, I serve as the Director of Faith and Community Partnerships for New Disabled South. And just a quick visual description, I am a dark skinned Black woman with black curly hair pulled back, black glasses, and I'm actually wearing a black One Nation Overcharged t shirt. My pronouns are she, her. And I'm honored to just share briefly a little bit about New Disabled South and what we focus on and why we've been excited about this partnership. So, a little bit about us. We are a disability justice organization committed to building power alongside disabled people living throughout the South. And we're an organization led by and staffed with a team of disabled people and caregivers. And I wanted to lead with that because the foundation of our work really is built upon the 10 principles of disability justice. Because we strongly believe that disabled people should not be an afterthought, and should instead really be helping to change and shape the policies and systems and the actual community, because all of this affects their lives, our lives, and those that we care for and those that we fight alongside. And so for us at New Disabled South, that looks like working with, similar to what Deanna lifted up, faith and community leaders, local and regional leaders and organizers and advocates, elected officials. In some cases, it honestly is just making sure that disability justice is a part of every conversation, because disabled people are a part of every community and every issue. And so we also advance policy and research. I am super proud of our Black Disability Institute, where we're centering the experiences of Black disabled people, particularly in the South, and really connecting that research to real community needs. So I am proud to do work with BDI, as we refer to it, because we know all too often policy and research, one that's created about disabled people, does not often include disabled people, and it more often than that does not include Black and brown people. So we are working to change that and ensuring that those lived experiences really help to inform those decisions. And so we're also expanding our digital and storytelling, and narrative power, because again, disabled people are often spoken to, and spoken about, but not really listened to. And so through storytelling and resources by us for us, it just creates a space or a container for disabled people to tell disabled stories, our own stories, name your own needs. And so one of the other things I want to mention is probably, our biggest lift right now is that we're working to strengthen care webs. And so, we all know that traditional systems are not doing what they should do, and they are failing disabled people every single day and other marginalized communities. But we also know that these are communities that have always taken care of themselves. I mean, this is what has happened for generations, through churches, mutual aids, food programs, caregivers, you name it. And so New Disabled South really supports these care webs through, small micro grants or other resources to help communities meet their needs. And, sometimes that support is advocacy and policy. Sometimes it may be doing a small funding amount to a community that's just trying to make sure the most vulnerable of people have their basic necessities. Or it may be, assisting a local church with a civic engagement or participation support. And, essentially for us, it all matters because survival and social justice to us are connected. So, I want to give a strong example, really, of our commitment to really sort of think about those left out and those not always centered. I think probably the biggest example is our partnership with One Nation Overcharged. Because as we've heard, it is a campaign about the unfair cost of healthcare at a timely moment. And we know for those living with disabilities, this is especially relevant. So, New Disabled South really encouraged the campaign to step a little bit further outside of their initial focus area. Also, so proud to see Georgians for a Healthy Future doing this virtually, because we know so many people impacted can't always make these events. So, we partnered to do two events, one in Savannah, which was a really beautiful event that we did with a local church there. And then we also did an event in a very rural community, Bena Vista, Georgia. We partnered with the city for that. Mayor Kevin Brown, who is someone I've worked with in the past and just have a lot of love and respect for Kevin and his work. And so we were able to partner with their huge back to school, and we gave out all of the One Nation Overcharge information, and it was needed and very well received. The community really leaned into it, and we did that along with school supplies and other resources. And it also gave us a chance to build relationships and really listen to the community, and it opened doors for us to do more work. Benavista is trying to build a playground, and they want to have an accessible playground for everybody in the community. So, one of the things that came out of this is that New Disabled South is exploring ways to support their dream of an accessible playground swing set. Maybe with even having an option for a wheelchair swing. And we know for kids living in rural Georgia that this is a big deal because it's also about dignity and belonging and access. And, to sum it all up, at New Disabled South, we are working towards a South where disabled people are even more empowered, and have more resources and access and can live and thrive. And so our work is about more than inclusion. It's also about liberation. And there's a component of that that we also work on. And so it is at the end of the day about making sure that disabled people are not only a part of the future, but we're helping to lead it. So I want to thank you all for giving me the opportunity to talk a little bit about our work over at NDS, and super grateful to our partners at Georgians for a Healthy Future for this opportunity. Send it back over to you, Deanna. Thank you.
Thank you so much, John. I really appreciate that. I love to see someone doing work for our disabled people in the community, because I get those calls all the time when they're waiting for their Medicare and they're in their waiting period where they're not eligible for Medicare, Medicaid, because we haven't fully expanded. So they are definitely a vulnerable population who are underserved, and they sometimes need that assistance more than anyone. So definitely thank you for the work that you do. We really appreciate you. Now, we did have additional speaker, but unfortunately she was unable to attend at this time. But we're going to move forward, and I may be able to open it up so y'all can voice and tell me some of the things y'all are going through and what you are all seeing in the community. But as we get close to wrapping it up, I do want to let you all know that healthcare should be a right, not a luxury. One Nation Overcharge is about bringing people together to speak up, organize, and push for healthcare systems that put people first. Collective voices can be a catalytic force for change. Together, we can demand better. Our race, our income, where we live should not dictate our health. And if we work together, we can be a nation where healthcare is affordable, where we all enjoy a healthcare system that puts people first, and where unchecked healthcare corporations are held accountable by those in power. Now, whether you have thousands of dollars in medical debt, or just fed up with high healthcare costs, or simply believe that we all deserve better, this fight is for you. This fight is your fight, and we want y'all to join us in this fight. Georgians for a Healthy Future are proud to be a part of this movement because we truly are one nation overcharged. And everyone feels that. And together we're fighting for a healthcare system that puts people first and works for everybody, not just for certain people. So at this time, I do want to give you all the opportunity. Our QR code on this screen, this is where you can scan to sign up to join in on the fight. Then we're also going to be sharing some links with you all there. They will be in the chat. If you feel like you want to speak up, you can definitely visit onenationovercharge.org. They have a video recording where you can share your story and how healthcare costs are affecting your life. And we also have our own story collection. So if you are someone who are uninsured, or even if you have insurance that's not working for you, that may be the Georgia pathways or a plan on the marketplace that has went up extremely, please feel free to share your story with us at Georgians for a Healthy Future. But we also want to give you the right to show up. You can show up to our next upcoming event if you're in the Atlanta region. We'll have our Atlanta Block Party on August 29th. We will provide the further information on the time and then the locations on the screen, but we'll give you details on all the other upcoming events that are happening across Georgia. And then for Georgians for a Healthy Future, we are having our celebration of progress and possibilities. This event is going to be hosted on September the 9th at the City Winery in Atlanta. So if you all would like to join us, we will share the link where you can register to attend. But we will be happy to have y'all up there, and would definitely love y'all to join in on the fight, because beyond this One Nation Overcharge, we want to show up for Georgia. So at this time, I definitely want to give you all the big thanks. Thank you all who showed up to participate tonight. If you had any questions or put them in the chat, we'll definitely address those as best that I can, and also Sean. We'll definitely address those. And if there's anyone who's on the call who wants to speak about something that they've experienced when it comes to high medical costs, please feel free. I want to give everybody an opportunity. If we do, I think we can raise our hand or either take yourself off mute so we can hear from you. Now, Anthony, let me know if I missed anything in the chat.
Hello, can everybody hear me?
Yes, ma'am, we can hear you, Miss Carnegie.
Hi. I did want to just jump on and say something I've experienced as far as high healthcare costs. I recently had a very unexpected health scare happening back in April, and Had routine labs, X-ray, and a CT scan, and one PO medication to treat what I was dealing with. And when I got my bill in the mail, I ended up having to do so much research to see if what I was being charged was even legal. Because they have like the Surprise Fee Act and all of this stuff. So I was being charged not only by the hospital, but I got a separate bill from the physician who treated me. I got a separate bill from the X-ray um, techs or company that provided the X-ray, and from the hospital, I also got billed for each exam, the medication, and there was a one lump sum of a bill for just the level that I was deemed. It was called a level 5 high alert, whatever. Usually, what I saw, and they're using different guidelines too to bill. So I'm looking at CPT codes and everything. This is things that are like way above, my knowledge, right? But I'm looking up all this stuff because I need to know, what do I say to these people to say that I don't believe I should be billed this much. That one bill for me being a level 5, that I didn't agree that I was level 5, but that one bill was like $4,300 alone. And then the rest of my bill was another almost $4,000. And I don't have an insurance plan that um, has me paying toward a deductible. I have like an indemnity plan because I am self employed, and it just costs a lot to have that type of insurance for me. And you don't need it until you need it, right? And so I needed it and I tried to use it, but I didn't expect to be charged as much. I'm not against paying my bills, but to charge me $8,000 to only have given me one dose of a PO medicine, like, I just did not agree with it. I written into multiple different departments at this point about the bill. I've asked for the chart to be audited. Um, Basically, what they said to me was, we're not using the guidelines that you are using to look at the CPT code that your bill was assigned. We're using totally different guidelines. And based off those guidelines, and we do 3 different tests, then we can code you a level 5. And every hospital has a sliding scale based off of what the hospital has resource wise to determine how much that's gonna be. So it could be anywhere from $100 to 100,000, depending on the hospital. I mean, that's an exaggeration, but that's basically what I was told. And then I was also told to reach out as far as like my health insurance plan goes and my contract work goes. They were like, well, just try to apply for like the hardship application and this, that, and the third. And they have not accepted anything because I can't tell them that my hardship is enough to where I require government assistance. Me telling them that I'm living off of a savings account is not enough. It's not proof enough to say that I can't afford a $7,000, $8,000 medical bill, and they wonder why people don't pay their medical bills. And it feels like going to the hospital is a scam. Like, I needed to go to the hospital really badly, but I wish I didn't go, because now I have $8,000 to pay for things that I don't understand why I'm paying. And then I didn't mention how much the bill was from the physician. I got a separate bill from the physician that is almost $2,000. And then the bill from the X-ray, that bill was cheaper, but it was another $350 outside of being billed for the X-ray from the hospital, and being billed because I got the X-ray and being called a level 5. It just was so many layers to it, and I just felt like it was so unfair, and nobody was listening. Everybody kept telling me they understood, but they didn't do anything. And even telling me to apply for assistance, I'm still getting the runaround. Like, and all I keep getting is these emails and letters that say, "Well, we've spoken to you about it. We understand your concern. If you need anything else, let us know." Like, I do. I still am in need, and I still have an $8,000 bill that I'm not willing to pay. To be honest, I'm just not
Right.
willing to pay it. So that's my story.
Thank now, we all have been there. I understand, and thank you for sharing your story, because when we get those unexpected bills and we're trying to figure it out, I'm over here trying to remember when you gave me this pill. So I may call and say, "Can I get an itemized bill?" Because I don't recall some of this. But having that frustration of trying to figure out why this bill is so high and it doesn't make sense. When I went to one hospital for one care that has supposed to have x-ray techs there, but you're getting multiple bills from one visit. That is ridiculous. And that's why we all want you to join in on this fight with us. So if you experience that or know someone who may be experiencing that, please ask them to join us on this journey under One Nation Overcharged. Also, reach out to us separately. You can reach out to New Disabled South as well as Georgians for a Healthy Future. Um, I just want to check if we have any questions in the chat or anyone else feel free that they want to address anything. All right, Emily, please come off mute.
Thank you. Can you hear me okay?
Yes, ma'am.
Thank you. So I have an experience kind of on both sides of healthcare, both as a patient and as a healthcare worker. And one of the biggest reasons I went into healthcare is because of stories like we just heard, where patients are drowning in medical debt, bills are astronomical, and patients are not given the tools or the education to navigate their conditions. Insurance is like a foreign language. And unfortunately, as much as I've tried to give them the benefit of the doubt, my um, my own challenges with medical conditions, with the chronic condition myself that I live with, and with navigating, trying to advocate for my patients to get the best medical care possible at an affordable level is like pulling teeth, and it's heartbreaking to me, and it makes me so angry. And I'm grateful for these organizations, for you all coming together and doing something about it to advocate for patients. I work in an outpatient clinic right now, and there are insurance companies that don't want to pay for medications. They want patients to go through cheaper medications first, which is another problem, why medication is so unaffordable in the pharmaceutical industry. But these health insurance companies, I've seen it firsthand, where they deny claims and they say, well, the patient has to try and fail this many medications first. And I've seen it with my own condition where I was suffering tremendous physical pain. And they say, well, no, you have to try these medications first. You have to get that prior authorized. You have to get X, Y, and Z. And these medical decisions that are not made by medical professionals, they're made by moneymakers trying to profit off of sick people. And I am so angry on behalf of not only myself, but my patients. And it's a reason I try to fight for my patients and for justice. And I saw it with my husband as well when he received a diagnosis and they said this condition could turn into cancer. And again, they said, well, he has to try and fail these medications first. And that's when I did some more research and I looked for organizations like yours that fight for patients, that are advocates, that promote justice and fairness and affordable health care. And I just have to say, it is frustrating, it is heartbreaking to wait on hold, to be to have these terms thrown at us like deductible and copay and premium that none of us were taught in school. And I come from a background of, I would say, a fair bit of privilege, and I acknowledge that. And I've been blessed with educational opportunities, and I try to use that to help others. And if it's this difficult for me to navigate as a healthcare professional, imagine how difficult it is for the average American trying to navigate the system, trying to find fairness in it. And I just really appreciate the work that you all are doing, and I'm excited to fight the good fight and to promote justice and liberty for all and affordable health care and accountability. So thank you.
Thank you so much, Emily. Thank you. You definitely said a mouthful there because even as an enrollment assistant, you know how many clients I talk to that sign up for a plan because it's the cheapest plan they can afford each month, but the deductible is $10,000. And before this plan begins to pay, they want them to meet $10,000 out of pocket. And a lot of people don't know. They just think they have health insurance, so they should have access to care. And they struggle with receiving those big out-of-pocket astronomical health medical bills, which they can't afford. So I thank you so much for speaking for yourself and behalf of your clients. And please stay connected with us through our newsletter and join our fight with our QR code as I shared previously. And after this presentation, I will be sending out an email with all of the information from the sources that we gathered this information from as it pertains to Georgia and our One Nation Overcharge. We will share out additional information on Sean and New Disabled South to let you know how to contact them and get and join their fight, as well as how to connect with Georgians for a Healthy Future. Again, if there's anyone else on the line, if I missed anyone, I do apologize, but I do want to thank you all so much for joining us today. All right, thank you all. I hope you have a wonderful night.
Thank you.
Thank you.